There was a woman who I took her blood pressure, and I asked her if she knew what these numbers meant, and she said no. And I asked, would you like me to explain them to you? And I did. She looked at me and said, no one in my 60 years of life has ever even asked me if I wanted to know what these numbers meant. She gave me a hug. I feel like everyone who works with LifeLong deeply has a passion for social justice, health equity. We all do this work from our hearts.
I see myself in the patients I treat. I just count my blessings and I try to do what I would want someone to do for me.
LifeLong Medical Care is a nonprofit, federally qualified health center based in Alameda County, Contra Costa County, and Marin County. And we provide primary health care, we do dental care, behavioral health. We have street outreach teams that go out into the streets, into these encampments to provide COVID resources. LifeLong provides services in any way you can think of for any age. So it's literally like lifelong care.
From a dental perspective, our mission is to minimize early childhood caries. So we have a robust sealant program. We take our van out to some of the elementary schools, some of the YMCAs, some of the Head Starts, because the best way to capture kids' oral health is to catch them when they're young, and also have engagement with the parents to let them know that they are the purveyors of their child's taste buds, and for them to be a lot more thoughtful in the choices that they're giving their child. Our mission is also to treat our adult patients, because adult patients often find themselves having even more limited options of places of care than children do.
The Heart to Heart program was created in 2008 when the Berkeley Health Status Report came out, showing that a small portion of South Berkeley, their rates of hypertension were so high amongst African American people. The city of Berkeley and LifeLong decided to partner to get funding to do programming surrounding cardiovascular awareness, free blood pressure screenings. Years later, we are now serving all of Berkeley and parts of West Oakland, which I kind of love because I'm born and raised in West Oakland. Some of the things we do with the Heart to Heart program is go out into community and set up shop wherever it may be, whether it be in front of a barber shop, a community health event, a grocery store, a senior center. So we go wherever the community meets and we do free blood pressure screenings, we do health education, alternatives to soda, and alternatives to little snacks like chips and things like that. So just alternative ways to live a healthier life. The food deserts in these low-income communities where we are based will of course result in high blood pressure, diabetes, and all these other chronic diseases. Then comes in the lack of trust in these doctors due to, just past experiences. So it's like, okay, I'm just gonna stay home, I'll be okay, which result in, unfortunately deaths. Just with the history of the medical industrial complex being so passive and just labeling people as numbers and not making that personal connection, I feel like the fact that Heart to Heart is able to go out into community and not be in this very sterile environment and to see people like us provide these services, I feel like it allows people to come in.
Heart to Heart is here today taking blood pressures and also informing people about health insurance if they don't have any, if they need a doctor. We're trying to connect people to resources and inform people about hypertension and how to improve their health.
Heart to Heart also does work with our oral health program. We give kids and anyone like a free dental kit, but we also show the impact of sugary drinks on teeth and also the impacts on high blood pressure and also diabetes.
At our Berkeley clinic, the overwhelming majority of our patients are adults, and they are dealing with dental infection, trying to replace teeth that are missing so that they can eat properly and get proper nutrition. And that's one thing I think that's overlooked when we talk about healthcare. Not being able to choose food properly contributes to the food choices, which then goes back into choosing processed foods, foods that are soft. And those foods often are not good for folks who are diabetic, hypertensive. So it can't be understated how important it is to maintain your teeth so you can smile and chew, most importantly, so you can get proper nutrition.
The Heart to Heart program also has the community health advocates, basically onboarding and training community members how to advocate for their community, how to do health education, how to navigate resources that are out there. We also have the mini grants program, which allows community members to apply for funding for their own programming that they have come up with or already have and just need extra support. Heart to Heart does so much. We also do a bunch of local partnerships just because there is strength in numbers, and the more community partnerships we have, I feel like we make a bigger impact. So the Multicultural Institute, we used to go out and do street outreach to do health education on the sugar-sweetened beverages, on cardiovascular health with our undocumented day laborers out here on 4th Street. And also the Women's Daytime Drop-In Center in Berkeley, working with women experiencing houselessness and children. Heart to Heart also has to host a community event every year. And it's kind of like a block party, but with COVID we had to cancel it last year. And so we were able to have our neighborhood health and wellness celebration. It was our 10th anniversary. And along with providing resources to healthcare, health education, we were also able to get local barbers to come out and provide free haircuts to the community, free vegetable and fruit giveaway provided by the Berkeley Food Network, a mama circle that was there to provide prenatal and postpartum services, massage. We had psychotherapy in the park. Just building community and seeing Heart to Heart expand and seeing people come through and get a free dental kit, get some healthy food, get a haircut, and get their blood pressure taken, that was the highlight of the year.